Welcome to my channel.
Electronic cigarette poisonings on rise in young kids. Most of the time, kids got their hands on electronic cigarette at home. Electronic cigarettes are sickening a growing number of young kids, usually because children drink the liquid nicotine that's used in the devices, a U.S. study of Poison Center calls suggests. Often, children aren't seriously harmed, but several have had severe complications like comas and seizures, and one child died from liquid nicotine poisoning. Even small amounts of liquid nicotine can cause serious poisoning or death in young children, said senior study author Dr. Gary Smith, director of the Center for Injury Research and Policy at Nationwide Children's Hospital in Columbus, Ohio. The study, which focused on Poison Center calls about kids under 6 years old exposed to tobacco and nicotine, found electronic cigarette posed the biggest risk to toddlers. Children in this age group are curious, have newfound mobility, explore their environment by putting things in their mouth, and do not recognize danger, Smith added by email. Big U.S. tobacco companies are all developing electronic cigarette. The battery-powered gadgets feature a glowing tip and a heating element that turns liquid nicotine and other flavorings into a cloud of vapor that users inhale. Smith and colleagues analyzed Poison Center data from January 2012 through April 2015. During that period, monthly calls related to electronic cigarettes surged from 14 to 223, they report in the journal Pediatrics. Overall, there were 4,128 calls about electronic cigarette, accounting for about 14% of the roughly 29,000 total calls related to children's exposure to nicotine and tobacco during the study. When kids got their hands on electronic cigarette, they were 5 times more likely to be admitted to a health facility and more than twice as likely to have serious medical problems compared to children exposed to traditional cigarettes, the study found. Most of the time, kids got their hands on electronic cigarette at home. Typically, symptoms from drinking liquid nicotine, like vomiting, nausea, and a rapid heartbeat, went away within a few hours. Among the children who needed medical care, less than 3% were hospitalized and roughly 2% had severe complications like breathing difficulties, seizures and comas. The study probably underestimates the risk of electronic cigarette, however, because it only includes cases voluntarily reported to poison control centers, the authors note. It's also possible physicians might be more inclined to report issues with electronic cigarette because the devices and the resulting medical problems are relatively new. Even so, the findings should serve as a warning to parents because drinking liquid nicotine can be much more toxic to kids than eating tobacco found in traditional cigarettes, said Dr. Sean Patrick Nort, an emergency medicine researcher at the University of Southern California Keck School of Medicine who wasn't involved in the study. Liquid nicotine is easier for the body to absorb than tobacco and cigarettes, Nort said by email. Because cigarette tobacco also doesn't taste very good, kids are less likely to ingest enough of it to seriously hurt themselves. By contrast, electronic cigarette can look and smell like candy to children, Nort added. Nicotine is also much more concentrated in liquids than in traditional cigarettes, noted Dr. Kyron Quinlan, a researcher at Rush University Medical Center in Chicago and chair of the Council on Injury, Violence and Poison Prevention for the American Academy of Pediatrics. A cigarette has about 1–2 milligrams of nicotine, but liquid refills for electronic cigarette are often contain at least 18 milligrams, Quinlan, who wasn't involved in the study, said by email. A small sip, say a teaspoon which is 5 milligrams, exposes a child to the nicotine of several packs of cigarettes all at once, Quinlan said. Parents should know that the highly concentrated liquid nicotine used in electronic cigarette is a new deadly poison, Quinlan added. The packaging, colors and flavors make these toddler magnets. Young children should have no access to electronic cigarette or their refill liquids because it could kill them.